And I'm delighted that we're going to be joined directly by Pam Cheng, the EVP of Global Operations for AstraZeneca. So Pam unfortunately wasn't able to travel this morning to be with us, but is kindly joining us here live. So good morning, Pam. How are you? And Happy New Year.
Good afternoon. Happy New Year, Michael. How are you?
I'm very good. Thank you very much. I was just giving you a quick introduction, Pam, is that you're a close friend of Ireland and indeed of IDA, and we're very thankful for your time here this morning as well. So really appreciate that. And just maybe for people in the room that would be maybe unfamiliar with Pam is the Executive Vice President of Global Operations, IT and Sustainability at AstraZeneca. And Pam has been at the leading, I suppose, light of transformation in the pharmaceutical industry for a number of years. And as I say, Pam, it's excellent that you're here to talk about operational excellence and indeed how innovation in healthcare is evolving as well. So really look forward, Pam, to getting your insights over the next 25 minutes or so. So thank you for that. So maybe, Pam, we might start there actually and maybe ask you for your perspective on science and innovation within the life science sector, the opportunities, maybe the challenges, and indeed we've just the panel before us was open AI, and I think it would be remiss of us not to have a conversation about where do you see AI sitting in the world of pharmaceuticals and healthcare as well.
Absolutely. So first of all, good afternoon, Michael, and thank you for the opportunity to join today. And speaking of AI and digital, one of the reasons why I can join remotely today. So hello, everyone in the room as well. So I've been in life science for some time now, and never have I seen this pace of change with respect to innovation. Specifically in the healthcare industry, we are seeing cutting edge science coming to life every day. And at the same time, there's an explosion of digital technologies available, which makes it a rather powerful combination that can really truly revolutionize how we deliver life-changing and life-saving care to people around the world. But before we get to the digital and AI, if I can just give a quick touch on science. Just a couple of examples how we are seeing cutting edge science and therapies that actually making a huge difference to patients around the world, specifically in oncology, for example. So treatments like cell therapy that can transform treatments across disease areas, including cancer, autoimmune conditions, and rare diseases. Today, what we call the autologous cell therapy, actually, it isolates and removes cells from the patients, modify it outside of the body, and reinfuse as a medicine. And it is already making a huge impact with patients living with blood cancer. And we see significant potentials for future tumors and autoimmune diseases. Another example is what we call the antibody drug conjugates. So, or the ADCs, it really combines the chemotherapy and targeted therapy to deliver powerful drugs to specific cancer cells, leaving healthy cells untouched. So the reason I want to mention these cutting edge science is that, digital and AI is making these science more powerful. It is allowing the drug development, drug discovery processes much faster earlier and bringing these innovations to patients much faster than in the past. In terms of oncology, unfortunately, many of us are touched by cancer in some way or another with our friends and family. So my own mother has cancer, and the possibility of making certain cancers chronic diseases, or if we dare to dream for a moment, perhaps one day even curing cancer, is incredibly motivating and inspiring for many, many of us. And artificial intelligence and digitalization within AstraZeneca is doing just that. We are bringing these innovation, new ways of treatment to the patients much, much earlier than in the past. So for example, AI models and platforms are now able to perform a fairly broad range of cancer evaluation tests to diagnose different types of cancer more quickly and more accurately, actually. And we are leveraging the power of data and AI to accelerate really our end-to-end of value chain from drug discovery to drug development, and certainly in manufacturing and supply as well. So, Michael, to your point, how do we sort of embrace this new reality and build resiliency? I really do believe that we really must learn to evolve and adapt. And doing so really requires some relentless simplification of ways of working. Sometimes the way we work are too complicated, bureaucratic. We need to really simplify it so we become more agile and more flexible so that we can adapt new technologies more quickly and more easily. And lastly, that pace of change will absolutely call for continuous upskilling of a diverse and inclusive workforce that is fit for future.
Yeah, I think, Pam, what you've articulated there is, I suppose, it's the power of technology, with science and how that can make a change. And you're correct, unfortunately, in all of our lives, we get touched, and our families, our friends get touched with disease of different shapes and form. And the question is how we can respond and how we use science and technology to help us to do that. And I think the work that you're doing and your industry are doing is certainly at the very forefront of that. As we know, there are actually curative elements out there. The question now is about making those available, commercial, and how that works as well is really, I suppose, the challenge, I would think, for the industry as it goes forward as well. I'd be just interested in your
Absolutely.
in your views there in terms of, if you want to call it, accessibility to future medicines as well.
So I think so. You cut out for a moment, Michael. Your question is around the accessibility,
Yes,
access to new medicines.
correct. Yes,
Yeah. So I think, this is a huge topic for not just AstraZeneca, but the pharmaceutical sector in general, which is as we make these science, as we translate great science into medicine for patients around the world, how do we make sure that at the quickest pace possible, that every patient who needs that medicine, no matter where they live, gets that medicine as quickly as possible? So it's a very important question, but a very has a very complicated answer, right? It really depends on the payers, the policymakers, the accessibility, the regulatory pathways within each of these countries. I would say more and more I do believe there are recognitions of what I would say early diagnosis, early treatment, particularly when it comes to cancer. We all know that cancer patients who get diagnosed early has a much higher probability of survival and better treatment outcomes. So these are the frequent topics where we work with the policymakers and regulatory stakeholders around the world on a constant basis.
of course, yeah. And maybe, Pam, just to maybe change for a moment to get your view, because it'd be remiss of me not to ask you, in the current geopolitical landscape, and what we're seeing and what we continue to see evolve ahead of us, what we need to be mindful in respect to that future global supply chain of medicines that you've talked about, and which actually leads itself to future access to medicines as well. So be interested in your perspective, of that, first of all, that supply chain, that value chain, because ultimately that does have an impact then on access.
So this is a tough topic, a
Yeah,
tough question. But and it's a topic that quite honestly, many of our peers and ourselves are on top of at the moment. Let me start by saying that medicine supply chains must remain global and open. It is critical for patients globally, no matter where we live. There are no country or region, in my opinion, in the world that can be completely self-sufficient. Sorry, sustainability, my office light just went off. There are no country or region in the world that can be completely self-sufficient with the resources, infrastructure, technology, scale, and the know-how that requires in drug discovery, drug development, and drug manufacturing and supply. At AstraZeneca, we see the geopolitical tensions. So supply chain resilience, it's at the top of our agenda. Our goal is to deliver life-saving medicines to patients around the world uninterrupted. So we focus on two things. First, we work collaboratively with policymakers around the world to recognize the importance of global and open medicine supply chains. Secondly, we are taking steps to ensure our supply chains are as resilient as possible through multi-sourcing and supply chain management tactics. And obviously, quite honestly, if I may be candid, locations like Ireland offers quite a bit of that resilience, right? As a progressive country, an objective country where we have the manufacturing excellence where we have the freedom and the friendly and supportive environment to operate. So these are the supply chain management tactics that we would deploy to ensure that our supply chains are as robust as possible. Now, I think COVID-19 vaccine is actually a very good example, an important example of supply chain resilience at the global scale. AstraZeneca developed and commercialized the vaccine in less than 12 months versus normally years. And we supply over 3 billion doses of the COVID-19 vaccine to over 280 countries, two-thirds of which are low and middle income countries and at no profit during the pandemic. This would not have been possible without the joining of resources, infrastructure, technology, and the know-how from dozens of partners and suppliers around the world. So if medicine supply chains were cease to be global in nature or faces numerous constraints in terms of medicine movement, our response to global pandemic such as COVID-19 will be significantly compromised versus a global and open supply chain that we have today.
Yeah. I think, Pam, you've articulated it very well there in the context of the strength that there is from, if you want to call it, a connected, open supply chain. And as we know, probably the challenge is to make sure that that message is continuously understood in the current environment. But just maybe it was almost an excellent segue when your lights went off there for a moment, because I just wanted to pivot over to talk about, as well as your role as Executive Vice President for Global Operations and IT, you are also the Chief Sustainability Officer, so it's no wonder your lights dim at a particular point. But I'd like to maybe, first of all, I think your leadership for sustainability has been recognised and actually has recently been recognised in Time magazine, so congratulations for that. And I know you're a regular contributor at the World Economic Forum on this topic as well. So maybe you could share your vision for AZ in terms of, and indeed maybe the wider industry in respect to sustainability, and especially when maybe some of the terminology now is that, sustainability and growth and innovation don't actually sit together. It'd be good to get maybe your sense as someone who is leading at the very cold face of this in industry.
Well, thank you, Michael, for the kind words. It's indeed humbling to be recognized by Time magazine, but it's really important to note that this recognition, along with many of the other top rankings of AstraZeneca sustainability, are really true testaments to the collective effort of the 90,000 plus colleagues around the world within AstraZeneca. So I have the privilege of receiving the recognition, but really was excellent work done by all of us within AstraZeneca. Now, we don't really need to look very hard to see that climate change is actually impacting the health of our planet and the health of our people. More than, I don't know if you all are familiar with this statistic, but more than 12 million people die each year from extreme heat and air pollution. 12 million, way more than COVID, right? And they are driving a steep rise in major diseases, including cardiovascular disease, respiratory disease, and cancer. So we are leading in sustainability because we have a profound responsibility to reduce our carbon footprint. The healthcare sector is in the business of helping people to be healthy. But at the same time, we contribute to about 5% of the global emissions worldwide. Now, you may say, well, Pam, it's just 5%, it's not that much. But just think about it this way. The healthcare sector, emits more emissions than the aviation sector. So our sustainability strategy really focus on not just fighting against the climate crisis and doing our part in decarbonizing across our own value chain, but also to do our part in restoring nature and also focus on health equity and health system resilience, sort of to the point you mentioned earlier, Michael, around medicine access. So when it comes to sustainability, we believe in one thing, which is we need to collaborate rather than to compete. within the sector and beyond the sector. We can do more at a larger scale and with greater impact when we work together and support the health of people and the planet. And because of that, we actually have significant number of partners. The Sustainable Market Initiative as one where our CEO is actually chair of the healthcare task force, where we try to partner with the right entities to ensure that we can amplify the scale and impact of what we are doing. Now, in terms of specific goals, within AstraZeneca, our goals, one of our goals is to reduce our scope 1 and 2 emission in absolute terms by 98% by 2026. Yes, 2026, which is next year.
Yeah, 12 months. Yeah.
My other day job is head of manufacturing and supply chain, as you mentioned. So I may be the chief sustainability officer for the company, but I'm also squarely in the hot seat. So we've been working very hard over the past few years to reduce our scope 1 and 2 emissions. We've actually reduced our scope 1 and 2 emissions over 68% at the end of 2023. We're still waiting for the end of 2024 number, but I believe that number is much higher, obviously, from 68%. So I'm happy to report that we are on track to deliver the commitment by the end of 2026 on scope 1 and 2. On top of that, the second half of our goal is by 2030, we will aim to halve our scope 3 emissions, which we have already started working with our suppliers and partner. Now, given the theme of this conference around digital and AI, I want to share an example on how we are using AI in sustainability, actually. So it's actually pretty cool. I can talk about it for hours, but I won't here. I'll give you the quick no version of it. So we are working with partners in the US and UK on renewable energy, specifically on biomethane. So for those of you who are familiar with biomethane, we use farm waste and food waste to convert into biomethane through what we call the anaerobic digestion process. And the process has been around for years and years and years, but it's never been modernized. So the productivity and the yield of the process is quite low. So we are now using digital twins to model the anaerobic digesters, the reactors, with critical processing parameters to increase the output of biomethane. So it really is pretty cool stuff. And we're not just using sort of digital and AI in our core business, but also really in some of the key objectives like sustainability. And before I forget, I'm also happy to note that our new API commercialization facility in Dublin will be green in 2026 with near zero scope 1 and 2 emissions.
Well, Pam, just to say, look, I think that's why you are recognised and why AZ was recognised in terms of when you hear that story, you are actually pushing the boundaries, in terms of sustainability while you're growing and innovating as a company. So, it's a real living proof that these things can coexist. In fact, they actually support each other in that context. And certainly it's great to hear of your collaboration and biomethane, we certainly in Ireland have lots of feedstock for that process as well with our agricultural background. So it's certainly an area that we also are looking at as from a national perspective. So we may be coming back to you to maybe for some more insights on that as I look out at some colleagues here in the room. But I'm just conscious of
Michael, can I just at one point, sorry about that. So just responding to your point around sort of this dichotomy of business growth and emission reduction. I think one very important fact is that AstraZeneca have shown we can fundamentally decouple business growth versus your emissions. So since 2013, we've more than doubled our revenue. But if you look at our emissions, we've actually reduced it by over 70%. So you can, and not only that, water consumption, waste generation, energy consumption, we've actually seen a reduction since our baseline. We use a baseline of 2015, while our revenue has nearly doubled. So really quite fascinating to be able to, and motivating to be able to demonstrate to the sector and beyond the sector that you can fundamentally decouple so that we can't hide behind this notion, our business is growing, our company is growing, so therefore my emission is growing.
Perfect note, and thank you. That's a really good example, and it's great to articulate that. I probably have a final question for you, but maybe it's a two-part or a three-part question, depending on what way you want to look at it. But Pam, you are very familiar with Ireland. As you know, you know Ireland very well from this role and from previous roles, and maybe it'd be just good, firstly, if you could share. What's the view of Ireland at the board table, in AZ or indeed at the broader board table from an executive perspective? It'd be good just to hear that. And secondly, then, as you look to the future of the industry, and the industry that you're leading in, where in Ireland should we look to continue to strengthen our proposition? Because, we're very clear that, we have achieved a lot in the last period of time and over a number of generations, but how do we make sure we embed it, we strengthen it, and we're fit for that future as well? So we're very clear on that. It'd be great to get your thoughts and insights on that.
Great question. I think, the strong pharmaceutical operating landscape in Ireland is well recognized. It's recognized by our leadership, including our senior executive team and our board. And the positive experience of our Alexion team, actually, since 2013 in Ireland, is a true testament of the supportive and effective operating environment offered by Ireland. So as you said, I'm an advocate of the Irish operating model, and I am very pleased that we are investing and expanding in Ireland. On that note, so just allow me to take a few seconds out to thank you, Michael, and your team for the tremendous support and partnership. It's always been a pleasure working with the IDA in my previous life and in my current life with AstraZeneca. In terms of opportunities, as an outward-looking nation that has built its economy on global trade, Ireland should continue to be a champion for innovation. By working collaboratively with European partners, we can strive to create a more balanced and supportive ecosystem for innovation that benefits all member states. Now, and secondly, to build on the success with the development of a national life science strategy to ensure that it continues to succeed in research, development, manufacturing, and applications of new technology. Now, there's a lot of projects happening in Ireland across the sectors. Sometimes I find myself sitting there thinking about potentially Ireland reaching that saturation point around skilled workforce, trained workforce. So how do we make sure we continue to train and upskill the workforce in Ireland such that as the economy grow, as the amount of work grow, we're not compromising on the skills and the quality of the workforce. So lastly, the Climate Action Plan for Ireland really sets out ambitious goals that sort of actually form part of our thinking in investing in Ireland. So my encouragement is please continue to invest in renewable energy and deleverage your reliance on fossil fuel. I think that will become a more and more of a competitive advantage on the international landscape.
Yeah, thank you, Pam. And I think, just to say, and I should have said this to you when I asked you the question, we have representatives in the room here from Nibert, the CEO of Nibert. We have a board member from Digital Manufacturing Ireland, and we actually have the Deputy General from Research Ireland here in the room as well. So I should have given you that heads up maybe before, as part of the question. But in the context, and especially when you think about the areas of research, of skills, of training, I think that's our commitment from an Ireland and a state perspective. And I think when you talk about collaboration, we're certainly very open, and as an organisation, and those organisations are open to ensure that we're developing the courseware and the capability and competencies that's necessary for the industry of the future, not just for today, but also of the future. So certainly, we're very thankful for your partnership, in AstraZeneca as well, to ensure we continue to stay at the front end of that. Maybe just on that point, if you had a wish for 2025 in the space of talent or research, what would you wish that Ireland would maybe lean into maybe a little bit harder?
Yeah, I think that's a good point. I think there's an opportunity for Ireland to secure greater investment actually in R&D. And I think on that basis, Ireland can focus and invest in sort of building infrastructure and policies with an enhanced sort of an innovation culture. Um, I think, Ireland has demonstrated a strong track record in supporting a robust ecosystem, but hold on to that will continue high caliber of talent and skilled workforce, and also investing in education and training programs that supports science and AI adoption, and continue focus on that AI and digitalization would attract global companies, particularly in the going upstream into the R&D space.
Yeah, I think, and that's really positive to hear you say that, because that's exactly where we believe, as a state, we can move in that, because I think digitalization and AI gives us an opportunity to actually push back into that research space, because the ability to conduct research in the future is very different than what it was in the past. So we actually have a whole new skill set we can bring, and an opportunity which we can lean into in the future as well.
Absolutely.
Pam, I just want to maybe close by saying thank you very much. Really appreciate your insights, and for taking time to share with us and to be with us here today, virtually, and unfortunately you couldn't be here in person, and we understand that as well. But just to thank you as well for your leadership, and your partnership with Ireland, but I think in particular your leadership of the industry, and particularly, as I mentioned, on sustainability, and because it is so critically important. Yes, we have to make sure we have innovative companies, but we have to make sure we bring all elements of that in terms of innovation, of impact and sustainability, and you certainly are leading the way for industry, as a whole in that as well. So we really want to recognise you and thank you for that, Pam, as well. Okay.
Thank you, Michael, and really a pleasure to be here today, and thank you for the invitation.
Thank you, Pam, and undoubtedly we'll see you in a few weeks. Appreciate it. Happy New Year again. Thank you.